Welcome to today's webinar on the Climate and Health 101 module produced by the Minnesota Department of Health. I'm Michaela Resch, a health educator and communications specialist with the Climate and Health program at the Minnesota Department of Health. The Minnesota Climate and Health program is part of a nationwide effort to anticipate, prepare for, and respond to health impacts of climate change. The program follows 5 overarching goals that help guide its work. First, educate and increase awareness of the health impacts of climate change. Research and improve data for research to ensure that our work is based on the best science available. Design and evaluate adaptation interventions. Develop tools and products for public health practitioners and others to use to prepare for climate change. And provide technical assistance to communities for mapping vulnerable populations and planning for climate changes. This training module is one of 6 training modules that address the health effects of climate changes in Minnesota. The other 5 training modules cover the topics of extreme heat, agriculture and food security, water quality and quantity, air quality, and well-being. These modules have been designed for public health professionals as well as others concerned about climate change to provide a basic level of information about the observed climate changes in Minnesota and their health impacts. Each module is a set of slides scripted with slide notes, so you can present them to your own audiences. We are sharing the other 5 training modules with monthly webinars starting today through December of this year. Following each webinar, we will post the training module on the Minnesota Department of Health website so anyone can access it for future use. These training modules are funded in part by a grant for the Centers for Disease Control and Prevention. I would now like to introduce our presenter for today's webinar, Chris Kimber. Chris is one of the climate and health planners at the Minnesota Department of Health. Chris received her master's in food science and nutrition from the University of Wisconsin-Stout. She has been with the department for over 25 years and is also a registered dietitian and physical activity specialist. Welcome, Chris.
Thanks, Michaela. Here's the outline for today's training module presentation. The module begins with the observed climate changes in Minnesota. Next, we'll cover the health impacts of climate change by looking at extreme heat events, air quality, flooding and drought, and other impacts of concern. The high cost of natural disasters will be covered next. Following that, we'll provide a number of strategies that public health professionals and individuals can do to address climate change. The module wraps up with communication information and tips. Before we get started with the observed climate changes in Minnesota, let's cover a few definitions. Although related, the terms weather and climate are definitely different. Weather generally refers to conditions of the atmosphere over a short period of time, like days or weeks, while climate refers to conditions of the atmosphere over long periods of time, like 20 to 30 years. Therefore, climate change refers to any significant change in the measures of climate lasting for an extended period of several decades. Here are the definitions for climate adaptation and climate mitigation. Actions to prevent the adverse health effects of climate change can be described as one or the other. For climate adaptation, this means to anticipate and prepare for the effects of climate change in order to reduce the associated health burdens. Climate mitigation refers to the efforts that slow, stabilize, or reverse climate change by reducing greenhouse gas emissions. Okay, now we'll begin with the observed climate changes in Minnesota. Our Climate and Health program at the Minnesota Department of Health is dedicated to understanding the links between climate changes and adverse health impacts and identifying strategies for addressing these health impacts in Minnesota communities. We designed this graphic to depict how climate and health are linked. Most climate scientists attribute our changing climate to the burning of fossil fuels, like coal and oil, to produce energy for everyday use. This burning adds heat-trapping gases into the air, like carbon dioxide and methane. These heat-trapping gases are commonly known as greenhouse gases. As this graphic shows, the rise in greenhouse gases is leading to increases in temperature and changes in precipitation. These changes are causing changes in air quality, weather patterns, water quality and quantity, and ecosystems, which in turn are leading to more air pollution, extreme heat, floods and drought, and ecosystem threats. One of the main effects of Minnesota's changing climate is that temperatures are rising. Minnesota has gotten noticeably warmer, especially over the last few decades. This slide shows a shift in the rate of change of Minnesota's annual average temperatures. The time frame is from 1895 to 2016, which is approximately the last 120 years. The left side of the graph shows Minnesota temperatures for the first roughly 60 years, from 1895 to 1959, where temperatures increased by about 0.2 of a degree Fahrenheit per decade. The graph on the right side of the slide shows the more recent 60 years, from 1960 to 2016, where Minnesota's average temperatures have accelerated to a rate of over 0.5 degree Fahrenheit per decade. This would amount to an increase of 5 degrees Fahrenheit that we would experience by the end of this century, a significant accelerated rate. This slide shows the same graph from the previous slide, but points out the 10 warmest years in Minnesota, shown with the red dots. As you can see, 9 of the 10 warmest years, recorded since 1895, have occurred in just the last 3 decades. This rising temperature trend is driving changes in the environment. It affects the length of our growing season and crop yields, the amount of time our lakes and rivers are covered with ice, bird migrations and insect behaviors, and even how we spend our time indoors and outdoors. Some of these changes have impacts on the health of people in Minnesota, and these health impacts will very likely increase. Within this overall annual warming pattern, there have been 3 significant observations in Minnesota. First, winter temperatures are rising twice as fast as the annual average temperatures. We are now experiencing more warmer winter temps, less snow and more winter rain, and changes in the amount of ice. Secondly, minimum temperatures, which are the overnight lows, have been rising faster than maximum temperatures, which are the daytime highs. In just the last 30 years, average annual overnight lows have been rising at a rate of 6 degrees Fahrenheit per 100-year period. And lastly, the northern part of the state is warming faster than the southern part of the state. Over the last 50 years, there has been a distinct spread of warmer overnight lows into the northern part of Minnesota. This is consistent with patterns seen across the northern hemisphere, where climate changes are occurring more rapidly at these higher latitudes. Rising temperatures are already causing substantial shifts in the environment. Maps of USDA plant hardiness zones show what types of plants will survive well and where. Zones are based on the average annual minimum winter temperature over a 30-year period, and each zone represents a 10-degree Fahrenheit increment. The maps on this slide compare two points in recent times. The map on the left is from 1990, and the map on the right is from 2015. Look closely at the changes in Minnesota over this 25-year period. In 1990, Minnesota was predominantly Zone 3 in the northern half of the state and Zone 4 in the southern half of the state. Jumping ahead to 2015, Minnesota is now predominantly Zone 4 across the majority of the state, with Zone 3 only in a small area in the far northern part of the state, and Zone 5 now emerging in the far southern part of the state. The other change that we are observing in Minnesota is a change in our precipitation patterns. With warmer temperatures, more evaporation occurs, and warmer air can hold more water vapor than cooler air. This slide shows Minnesota's average annual precipitation. The time frame is the same as the temperature slides, showing the past 120 years, from 1895 to 2016. The graph on the left highlights trends for the first roughly 60 years, from 1895 to 1959, and the graph on the right highlights the trend for the recent roughly 60 years, from 1960 to 2016. For the first 60 years, the trend in precipitation was slightly downward, at a loss of 0.2 of an inch per decade. This downward trend was influenced by the Dust Bowl years of the 1930s. However, the rate of precipitation in the more recent 60 years has increased by nearly 1/2 of an inch per decade. Along with the increase in average annual precipitation, the character of precipitation is changing in Minnesota. The overall increase in our average annual precipitation is being driven by heavy rain events. The graphic on this slide points out that there have been 15 historic mega rain events in Minnesota since 1858, which is when weather record keeping began, about 160 years ago. A mega rain event represents a huge amount of rain over a very large geographic area. This is characterized by 6 inches of rainfall covering more than 1,000 square miles, with the core of the rainfall being at least 8 inches. To help visualize the size of this large geographic area, 1,000 square miles is the entire size of Crow Wing County in west central Minnesota, or the combined size of Hennepin, Ramsey, and Washington counties in east central Minnesota. Over this 160-year period, 7 of these 15 historic mega rain events have occurred since 2002, just in the last 15 years. And for the first time, we had 2 mega rain events in the same year, one in July 2016 and one in August 2016. Even though there is more moisture in the atmosphere, that doesn't necessarily mean a consistent rise in rain and snow. The changing character of precipitation in Minnesota brings the potential for both extreme wet and extreme dry spells. Increases in heavy rain events have the potential to cause both increased flooding and drought. Based on the localized nature of heavy rain events and their intensity, this can leave some areas of the state drenched and other areas without any precipitation. An example was the year 2012. In that year, 75 of Minnesota's 87 counties were declared disaster areas for drought, shown as the brown shaded counties on this map. In that same year, 15 counties, along with 3 tribal reservations, were declared disaster areas for flooding. These are the blue shaded counties on this map. For the 15 counties that were declared disasters for flooding, 8 were also declared disasters for drought within the same year. These are the light blue crosshatch counties on the map. This underscores the intensification of precipitation extremes in both directions. Climate change is described as the greatest public health challenge of the 21st century because it threatens the very basic needs that life depends on: air and water, food, shelter, and security. This next section will focus on the health impacts of climate change. First, we will cover extreme heat events. The definition of an extreme heat event varies based on what is normal for an area. It includes variations in temperature, humidity or dew point, the type and amount of clouds, and how acclimated the people in the area are to heat. Therefore, an extreme heat event is when weather is much hotter and/or more humid than normal for a particular location at a particular point in time. We also refer to these events as heat waves. As you may know, our bodies function best around a body temperature of 98.6 degrees Fahrenheit. During a heat wave or extreme heat event, our body's ability to stay cool may be limited. If we can't stay cool, a range of heat-related symptoms and conditions can develop. Some of these are relatively minor and easily treated, like heat cramps or heat rash. Others are much more serious, such as heat exhaustion. If left untreated, heat exhaustion can lead to heat stroke, which is a life-threatening medical emergency where the body temperature rises to 104 degrees Fahrenheit or greater. High body temperature can damage vital organs, cause nerve damage, and can even lead to death. A number of factors that increase the risk of illness or death due to extreme heat are listed on this slide. Three of these factors to highlight are lack of air conditioning at home, so a person can't cool down, especially for sleeping at night. Living on the topmost floor of a house or apartment because warm air rises and is often trapped on the top floor. And being active outdoors on warm days can be a risk if a person is not acclimated to the extreme heat. One of the risk factors listed on the previous slide is living in urban areas. This is due to the urban heat island effect. This effect is a measurable increase in urban air temperatures that can result in much higher overnight temperatures as compared to suburban or rural areas. This is caused primarily from having less vegetation or green space in urban areas, along with a higher concentration of buildings and roads that absorb heat throughout the day. Surfaces that absorb heat during the day release that heat at night, causing the nighttime temperatures to stay high. Everyone is at risk during a heat wave. In addition, a number of specific populations that are more vulnerable are listed on this slide. These include adults 65 and older and children 5 years and younger, people with pre-existing diseases like heart disease, and people taking certain medications such as diuretics or psychotropic drugs. Now let's look at air quality issues impacted by air pollutants and allergens. Climate may affect exposure to air pollutants and allergens in a number of ways. Changes in the climate may lead to both more windy and more calm days. On the calm days, the still air can be stagnant and pollutants can hang in the air as smog. With higher temperatures, the demand for more air conditioning can lead to increased pollution because more fossil fuels need to be burned to create more electrical power. Also, a longer growing season causes more pollen to be produced, and this leads to a longer allergy season. Climate change is expected to lead to more air pollutants, primarily ground-level ozone and particulate matter. These pollutants can have serious health impacts. They can cause breathing problems like bronchitis, pneumonia, and asthma. Pollutants can aggravate allergies and respiratory problems and put people at risk of developing heart disease and even some cancers. And people with any of these conditions may experience chest pain, shortness of breath, wheezing, coughing, or fatigue. people are more sensitive to air pollution than others. These vulnerable populations listed on this slide are very similar to the populations that are vulnerable to extreme heat, as shown on an earlier slide. Climate change is also increasing the exposure to allergens like pollen and mold. The amount of pollen produced by plants and trees is increasing due to the lengthening of the pollen season. This slide shows an example of the change in the length of the ragweed pollen season in and around Minnesota between 1995 and 2015. The larger the red circles, the more days that are now being experienced from the increased length of the pollen season. In Minnesota, we've observed an increase in our ragweed pollen season by 15 days in the southern part of the state to 21 days in the north. Mold growth is enhanced by more moisture that can come from increased precipitation or floods, an increase in temperature or humidity, changes that are coming from the climate change. People vulnerable to the health impacts of pollen and mold are those with existing allergies, and climate change is causing them to suffer more. Next, we'll look at the health impacts from flooding and drought. Flooding can cause a number of health impacts as listed on this slide. A few to note are the risk of getting sick from eating contaminated food or drinking contaminated water, the possible loss of housing or the inability to get to work because roads, homes, or buildings are flooded. Mental stresses can be compounded from having to clean up and repair damaged property, replace belongings, deal with insurance, and in some cases, find a new place to live or work. People who are at greater risk of health issues due to flooding are listed on this slide. One of the most common risks is being out at night during a flash flood. About 75% of flash flood deaths occur at night because people can't see how deep the water is or where it's coming from. Another common risk is driving through flooding water. About half the people who die from flooding are in a car or other type of vehicle driving through flooded water. As mentioned earlier, some areas of the state will experience less precipitation, leading to drought conditions. Drought and lower water levels are associated with a number of health impacts listed on this slide. One of the most devastating and far-reaching impacts is the potential for a decrease in the water supply available for agricultural purposes. This could lead to lower crop yields or the total loss of some crops, and therefore could reduce the overall food supply. Drought is a particular concern in Minnesota because of our multi-billion-dollar agricultural economy. Drought conditions can also increase the risk of wildfires. Health impacts from wildfires can include physical injuries, breathing and respiratory problems due to smoke inhalation, and increased mental health stresses. People at greater risk of health issues due to drought are listed on this slide. They include people working in occupations like farming, fishing, and boat or barge shipping. In addition, many people could be vulnerable to drought if it is widespread enough to reduce access to food and drinking water. To wrap up this section, we'll cover a few other health impacts of climate change. Climate changes such as warmer temperature, increased rainfall, longer warm seasons, and less severe winters could impact the range and incidence of vector-borne diseases. Vector-borne diseases refer to diseases spread from vectors such as ticks and mosquitoes. An example is shown on this slide. The three maps show a change in the incidence of Lyme disease carried by black-legged ticks, also known as deer ticks. Within these recent 5-year time frames shown on each map, the incidence of Lyme disease has increased substantially. Similar changes are being studied for mosquito-borne diseases that are common in our area, like West Nile virus and La Crosse encephalitis. Severe weather can cause the power to go out. These power outages can create a number of health impacts. For example, people can get sick from consuming contaminated food if there isn't any refrigeration, or drinking contaminated water if the water treatment facility loses power. There is an increased chance of house fires because people may rely on candles for lighting. There can also be an increased risk of carbon monoxide poisoning if people are relying on gas-powered generators and they aren't sufficiently ventilated. While we will all be impacted by climate change to some extent, we must acknowledge that climate change is a powerful risk amplifier, particularly in regards to health impacts. Climate change will disproportionately impact many of the communities that already experience health inequities. Across the United States and within Minnesota, inequities in living conditions, financial resources, and health status place low-income communities and some communities of color at a greater risk of experiencing the negative health impacts of climate change. In order for our communities to be strong and resilient in the face of climate change, we must focus on reducing health inequities. These are, in large part, based on the social determinants of health, the conditions in which people are born, live, learn, work, and age. Addressing climate change offers a tremendous opportunity to address health equity. We all have a role to play in creating a place where all communities are thriving and all people have what they need to be healthy. This next section will examine the cost of natural disasters. This map shows the number of times each state in the country has been part of a billion-dollar weather or climate disaster of any type from 1980 to 2016. The darker the red, the greater number of billion-dollar events a state has experienced. During this time period, 203 of these billion-dollar disasters occurred in the United States. Minnesota was included in 31 of them. One notable national disaster was the 1980 drought and heat wave experienced in the central and eastern part of the country. This included Minnesota. Damages to agriculture and related industries over this entire impacted area totaled $48.4 billion and led to an estimated 10,000 deaths. Besides the 1980 drought and heat wave, other billion-dollar disasters that occurred in Minnesota included floods, severe local storms, winter storms, and wildfires. In June 2012, northeastern Minnesota experienced an extreme heat rain event that caused severe flash flooding and river flooding when the St. Louis River rose over 10 feet in 24 hours, cresting at a record high of 16.6 feet. The flooding caused damages to infrastructure that included roads and bridges, water and sewer systems, electric utilities, and communications infrastructure. In addition, over 1,700 homes and 100 businesses were damaged or destroyed. This included structural damage loss of utilities, sewage backup, and increased mold growth. For this next section, we will cover some examples of strategies for mitigating and adapting to climate change that can be implemented by public health professionals and individuals. Public health professionals can play a role in mitigating and adapting to climate change. This slide lists 5 of the 10 essential public health services. Using the 10 essential services as a foundation for action, public health professionals can play a number of roles in climate mitigation. An example that would fall under the first essential service listed on this slide is educating about the health benefits of active transportation modes like biking, walking, and transit use. In addition to the health benefits, these transportation modes reduce greenhouse gas emissions. An example that would fall under the third essential service listed would be developing plans for a community garden where people can access locally grown foods. This would reduce food transportation, and that would lead to reduced greenhouse gas emissions. Public health professionals can also play a role in adapting to climate change by understanding how climate change affects human health and which populations in your community are most likely to be affected by climate change. This slide lists the other essential public health services, and these can guide climate adaptation strategies. An example of the first essential service listed on this slide would be tracking community health status impacted by climate change events, such as extreme heat or poor air quality. An example of the third essential service listed would be maintaining a robust all-hazards plan that includes planning for and responding to severe storms, extreme heat, and power outages. We as individuals can play many roles in mitigating and adapting to climate change. The next slides list actions each of us can take to make a difference. Energy production is one of the big 3 contributors to our changing climate because burning oil, coal, and natural gas to generate electric power puts a lot of greenhouse gases into the air. As individuals, we can each reduce the amount of greenhouse gas emissions we cause in a number of ways, like using less energy to heat or cool our homes, using energy-efficient appliances and light bulbs, and reducing, reusing, and/or recycling what we buy and what we use on a daily basis. However, what is really going to make a difference is having all of us rely more on renewable energy sources like solar, wind, and biofuels, and less on fossil fuel energy sources like oil, coal, and natural gas. As individuals, we can support public and private sector policies that lead to more renewable energy production. A policy example is Minnesota's Next Generation Energy Act of 2007, which has achievable greenhouse gas reduction targets for the year 2025 and beyond. Transportation is the second big contributor to our changing climate because burning fuel to power vehicles emits a lot of greenhouse gases into the air. We each can reduce the amount of greenhouse gas emissions we cause by using transportation options that burn less gasoline or diesel fuel, like walking, biking, using transit, and carpooling or telecommuting when possible. Another option would be to drive an electric car powered by wind or solar energy. But what would really have an impact is if we all have more transportation options that either burn less or don't use any gasoline or diesel fuel. This can be done by supporting public and private sector policies like increasing fuel efficiency standards, incentivizing the production and purchase of electric vehicles, building more transit options where sufficient population density exists, and adopting policies that support telecommuting. Agriculture is the third big contributor to greenhouse gas emissions because it takes a lot of energy to produce, process, and transport food. As individuals, we can each reduce the amount of greenhouse gas emissions we cause by buying more locally grown foods, eating fewer processed foods and less meat, and even growing some of our own food. However, what is really going to make a difference is if we all have access to foods that are produced, processed, and transported using less energy. As individuals, we can support public and private sector policies that incentivize foods produced with fewer chemicals, foods that are less processed and closer to their natural state, and foods that are transported shorter distances. This final section will cover how to communicate about climate change. Americans are generally unaware of the current and potential health consequences of climate change. According to a recent report from the Yale Project on Climate Change, only about 1 in 4 Americans could name at least one health problem related to climate change. And 10% answered incorrectly that there are no health problems associated with climate change. There also seems to be a disconnect between recognizing the broader impacts of climate change and the personal impacts. As shown on this slide, the Yale Project on Climate Change found that 52% of Americans and 52% of Minnesotans as well cited that they are worried about climate change. However, as shown on this slide, only 34% of Americans and only 32% of Minnesotans think that climate change will harm them personally. This limited awareness strongly indicates the need for more public education about the impacts of climate change on human health. Most Americans think of climate change in geographically and temporally distant terms. That is, that it is more likely to affect plants and animals, future generations, or people in developing countries. Fewer Americans report that climate change has any connection to human health, and that it is least likely to affect their own community or themselves. With education, however, people are easily able to understand the relationship. Here are some communication tips for talking about climate and health. Start by putting people first and connecting on common values. Do your homework to understand your audience's concerns, then find ways to connect on shared values. Secondly, make the data real. Use tangible examples from your audience's own location as often as possible. And use examples that let your audience see themselves in the solutions. Lastly, frame climate change as a human health issue and emphasize health solutions. Many people perceive climate change as only affecting the environment. People respond best to actions they see as benefiting themselves as well as the climate. Do keep in mind, however, that regardless of which communication strategies you use, you likely won't be able to convince everyone that climate change is happening, and that it is a human health issue. In summary, Minnesota's climate is changing with increasing temperatures and changes in precipitation. Climate changes can lead to risks that cause serious health impacts. On the bright side, there are actions you can take to reduce the health impacts of climate change. We hope you found this presentation useful in supporting your efforts to address climate change and health. Thank you for your time.
Thank you for participating in Climate and Health 101. If you have any questions or would like additional resources or materials, please contact the Minnesota Climate and Health Program at the Minnesota Department of Health. Thank you.